For polio eradication, it's a global initiative, and it's geared to make sure that we're able to reach each and every child, no matter where you are in the world, which means that we're able to deploy people, funding, vaccines, cold chain, to make sure vaccines turn into vaccination where they're needed the most. When we look at how we engage and support more broadly, I will zoom in on 3 specific topics. The first is surveillance. Surveillance allows us to identify and assess risk. When our frontline surveillance officers visit communities, visit health facilities, visit hospitals, they're not just reporting back on polio. They're reporting back on measles, they're reporting back on diphtheria. All of this information comes back to help inform risk assessment and planning in terms of how we manage the response. We support the movement of samples from field locations back to laboratories because we have all of this infrastructure already in place. I think the second area that I would highlight is something that people might consider very simple: microplanning. Microplanning is really understanding where is every child within a country, where are the children located. If we go back to Malawi and Mozambique, what we found is that from our initial campaigns in both countries, we were missing more than 30% of the children because they were not on the registers for essential immunization. So what polio does is that it goes down to every local village, make sure that we're able to identify each and every child so that not just for polio, but for essential immunization going forward, we're able to reach these children. And then last but not least, we conducted more than 800 million immunizations across the globe last year. We used that opportunity to introduce other antigens. Measles is probably the best, but it has included a range of others. We also add soap, we add nutrition, we add a whole range of things to address what communities at greatest risk need the most. So it is a critical infrastructure, not just for polio, but for public health and emergencies at large.